Well, good morning, everyone, or good afternoon, depending on where you are in the country. My name is Jennifer Pierce, and I'd like to welcome you today to the Health Literacy Solutions Center April webinar. This is our first of 2 webinars this month. We have just a few housekeeping items to go over before we begin. And letting everyone know that audio is provided through your computer speakers. There is no dial-in option. All attendee microphones will be muted for the duration of the webinar. If you happen to join, just please make sure if for some reason that's not happening, you go ahead and mute yourself. There is no need for video unless you'd like to have your video on. That's up to you. Please feel free to ask questions throughout the webinar, and you will notice if you scroll to the bottom of your screen, you'll see a little conversation bubble. That bubble will bring up a chat feature on the right, the lower right corner of your screen. You can send a chat to everyone or to someone in particular. And if you would like to pose questions throughout the webinar, which we highly encourage, please send them to everyone. Type your question. I'll be monitoring those throughout, and at the appropriate time, we'll pose them to our speakers today. But as much as possible, we'd like this to be an interactive experience. And I know we've built in plenty of time, and we have a wonderful health literacy expert with us today. So we want to make sure we take advantage of her expertise. So please feel free to participate. If you have any technical difficulties during the webinar, we have an email listed on the slides that are toggling back and forth. And perhaps, Mario, we can pause on this slide. It's support@healthliteracysolutions.org. Again, any technical difficulties, email support@healthliteracysolutions.org, and Mario will reach out to you and see if we can't get it resolved. In the off chance that something goes wrong during the presentation and you're not able to listen or hear the entire thing, don't worry. The slides will be, or the presentation rather, is being recorded and will be emailed out to all attendees afterwards. So you will not miss it. You'll still have a chance to review it. And at the end of the webinar, anyone who has signed up for CEUs, following the conclusion, you'll receive an email that has an evaluation form embedded. We greatly value your feedback. We use it to select topics and speakers for subsequent webinars and obviously improve as we go. So please do take a moment to provide that feedback. And also, if you signed up for CEUs, that feedback, that evaluation form is your ticket to getting the CEU. So you'll see that at the bottom of the screen right now. So with that said, all of the housekeeping out of the way, I hope this finds everyone well. Families and your colleagues. I'm thrilled to be together as a community today and have the opportunity to listen to this very, very timely topic. It's clear communication during the COVID-19 pandemic. We'll hear about the various ways health literacy may be impacting the response to COVID-19 and learn some practical tips for communicating clearly during a public health emergency. If there was ever a time for clear communication, this is it. And we'll conclude with a virtual tour of the Health Literacy Solutions Center COVID-19 resource page that serves as a centralized repository for pandemic-related content recommended by you, the health literacy community. So I know there's a lot going on the website or the Health Literacy listserv right now, and the Health Literacy Solutions Center has done a great job of consolidating that into one place, easily searchable. So it is my pleasure to get us started today, introducing our speakers, Stacy Robison and Eskarlethe Juarez. Now, many of you know Stacy, the president of Communicate Health. It's a business she started at age 30 in her attic. It's just stunning to me, knowing where it is now. 11 years later, Communicate Health has more than 90 employees and an impressive roster of government and private sector clients. Stacy has been a key player in the field of health literacy for the past decade, focusing on digital health literacy and public health. And if you haven't signed up to get Communicate Health's We Love Health Literacy emails to your inbox, please do so. They're highlights and wonderful little miniature depositories of nuggets that I return to again and again as a health literacy practitioner. And at the end, Eskarlethe will follow her presentation with an online tour of the COVID-19 resources. And Eskarlethe is a health education associate at the Institute for Healthcare Advancement and helps lead the effort to mine resources from the health literacy listserv so they're easily searchable and accessible by members of our community. So with that, let's get started. Stacy, I will now turn the presentation over to you.
Everyone, I'll just make sure you can all hear me okay.
We can.
Excellent. So hi there, I'm Stacy Robison, president and co-founder of Communicate Health. I decided to use my quarantine headshot for today so you can all see what I look like working from home up in Maine. I promise I'm wearing pants today. And like most of you, I am also not alone, so you may hear my family in the background, but hopefully not. And I also just have up on this slide our Twitter handle at Communicate Health. The Communicate Health team is pretty active on Twitter, and we're trying to share a lot of good plain language information and resources. So if you don't follow us, I encourage you to do so. I've been working in the field of health literacy for close to 20 years. And a lot of our work at Communicate Health is helping public health professionals communicate clearly about complex topics. Today, I'm going to talk about what this looks like during the current pandemic. But first, I'm going to unpack the ways in which health literacy is affecting our response to the current crisis. Let's start with what I call the Captain Obvious slide, which is that communication is critical during a public health crisis. We all know that. And when we're communicating with the public, we need to consider health literacy. And there are several reasons for this. I will give you 3 of them today. First, it's that most adults have limited health literacy skills. And second, some groups of people are disproportionately affected by limited health literacy. And they are often the same groups that are disproportionately impacted during an emergency. And so we have an ethical and social obligation to protect their health. Plus, research tells us that tailoring our communications so that they're more easily understood by people with more limited health literacy skills can make them more quickly and easily understood by everyone else. Now, the term health literacy has several definitions, all of which relate to people's ability to understand and apply health information. There are 2 sides of the health literacy equation: the extent to which health professionals and systems can communicate clearly, and on the other side, the extent to which individuals have the skills and knowledge to access and understand those communications. If you change one side of the equation, you impact the other side. In other words, if we can improve the clarity and simplicity of our communications as health professionals, we can improve the health literacy of our patients and the public. Health literacy is too often defined as a deficit. So particularly when it comes to preventing and managing disease, we talk a lot about people lacking health knowledge or skills, and that this in turn leads to poor health outcomes. But health literacy can also be defined as an asset, linked to individual empowerment and the ability to participate in decision-making about our own health and the health of our families. Viewing health literacy as an asset helps us appreciate its potential to act as a protective factor in the face of a complex health crisis like the one we're in today. So how can we boost health literacy and boost this protective factor when it comes to communicating about COVID-19? First, it's helpful to understand and examine the ways in which health literacy is impacting current events. Health literacy can be viewed as several interrelated concepts that all impact how we understand and apply health information. Back in 2005, several health literacy scholars proposed what they called an expanded model of health literacy, characterized by multiple domains. I see several of these domains at play in the current pandemic. Fundamental literacy, science literacy, civic literacy, media literacy, and cultural literacy. All of these domains are overlapping and intertwining and compounding and ultimately affecting how we seek out and understand information about coronavirus and how we behave. So let's unpack them. First, fundamental literacy. This is what most of us think about when we think about literacy or health literacy. These are the skills needed for reading, writing, speaking, and understanding numbers. About half of adults in this country struggle with fundamental literacy. And there is a lot of coronavirus jargon out there. Just the name of the disease alone has all capital letters and a number. These are a bunch of other terms that we also see on a regular basis in the media. Terms like immunity, exposed, droplets, quarantine, transmission, incubation period. And next we have science literacy. Science literacy involves understanding of basic scientific concepts, including information about biology, the human body, and germs. If we look at the current COVID-19 outbreak, we're expecting that people can do things like identify symptoms of the new virus and take appropriate action. Understand epidemiology, including concepts like asymptomatic spread, quarantine, and community transmission. And understand and evaluate risk, both their own personal risk and the risk they pose to their community. Science literacy also includes an understanding of scientific uncertainty, which is absolutely critical in a public health emergency. Not only do we need to understand the science, we need to understand that the science is changing every day. And we see a lot of headlines like this. It's not that the scientists are always getting it wrong, although sometimes the politicians are getting it wrong. It's that the science is evolving. Next, we have civic literacy, which is a really broad concept, but it includes an awareness that our individual health decisions can impact the health of our community. This is the whole idea behind flattening the curve. Civic literacy is at the very root of public health, and if you work in public health, you know that this is a tricky concept. For example, we need you to vaccinate your kids not just because it will protect them, but because it will protect other people. Or we ban smoking in bars to protect your health, but also to protect the health of the employees working in the bar. So we're asking you to stay home to protect your health, but also to cut off the chain of transmission and protect the health of everyone else. This is one of the best descriptions I've seen. This is from Ed Young, who wrote this in The Atlantic. Think of it this way. There are now only two groups of Americans. Group A includes everyone involved in the medical response, whether that's treating patients, running tests, or manufacturing supplies. And Group B includes everyone else, and their job is to buy Group A more time. The very concept of social distancing and quarantine hinges on people having basic levels of civic literacy. And we can't talk about civic literacy without acknowledging that in the United States, there's widespread mistrust of institutions and authority, including government. I was reading recently that they released the 2020 World Happiness Report, and spoiler alert, the Finns won again. Unfortunately, the United States actually fared worse this year. If you're curious, we've now fallen to 18th place. But what's interesting is the connection between happiness and trust in government and your fellow citizens. I promise this is all related. So in Finland, there's a sense of shared responsibility. In fact, in Finland, 91% of survey respondents reported being satisfied with their president, and 86% said they trust the police. So according to a Finnish researcher who contributed to the report, during the current COVID-19 crisis, people are willing to follow instructions and trust that everyone will do their part. Every time the president or the prime minister holds a public speech about the issue, the overwhelming response is one of trust and commitment. Not so in this country. Next, we have media literacy, which can also be seen as a subset of civic literacy. So if you don't have faith in public institutions, how do you know which information you can trust? For example, when our president is saying that we'll have a vaccine relatively soon, and as public health professionals, we all know that this process can take years, who do we believe? What do we believe? We also know that health information seeking behavior, including the ability to evaluate health information and choose high quality sources, is one of the mediating factors by which health literacy affects health outcomes. Studies show that people with lower health literacy skills are more likely than those with higher health literacy skills to use TV, social media, blogs, celebrity web pages for their health information. And this is a challenge right now when there's an abundance of misinformation on social media, and even on the news if we look at the early days of the pandemic. And during these times of uncertainty, people are looking for easy answers, which makes them vulnerable to scams. False news travels faster than real news, often much faster. This was documented by some researchers at MIT, and we all learned this lesson the hard way during the 2016 election. That's because fake news is designed to grab people's attention by connecting with their emotions, such as fear or outrage. And unfortunately, our challenge right now is not just misinformation, but a lack of good information. Another thing we know about health literacy, it's content and context specific. This is absolutely fundamental to understanding how people interpret health information. So what do we mean by this? There are geographic differences that affect how we understand and act on health information. People may respond differently if they're living in rural Wyoming or if they're in the epicenter in New York City. And let's not discount demographic differences. Consider our Gen Z spring breakers with maybe the reaction of older adults or folks in their 70s and 80s. All of this ties into social norms, which we know is a factor in changing behavior. What do you perceive people in your community or your social circle are doing? Are they sheltering in place? Are they wearing masks? We know the virus is disproportionately impacting communities of color and low-wage and service workers across the country. And we've only just begun to look at rates of infection and death broken out by race. So there's also a cultural literacy component here. Cultural literacy is the ability to recognize the role social identity plays in interpreting and acting on health information. For example, consider the experience of being a man of color wearing a mask or a bandana out in public, or the experiences of Asian Americans during the early days of what our president repeatedly called the Chinese virus. Finally, when it comes to context, we know that stress and anxiety negatively impact message comprehension and retention. And we can all acknowledge that these are stressful times. You may be a coronavirus news junkie, but everything shifts when your spouse is all of a sudden running a fever. Should you go to the doctor? Wait, did they say to take ibuprofen or acetaminophen? Our individual ability to understand and act on health information can change in an instant when we're experiencing stress. Let's consider the other reality. All of this is compounded by a rapidly evolving situation. The guidance is changing day to day. And we are in an environment of uncertainty. And let's face it, we hate uncertainty. In fact, when you ask people what makes them more uncomfortable, knowing that something bad is definitely going to happen or that something bad might happen, guess which one they pick? That's right. People are most uncomfortable with uncertainty, so uncomfortable that they prefer the negative outcome. And right now, we are asking people to embrace an uncomfortable level of uncertainty and risk, and we have to acknowledge that. As the coronavirus pandemic continues, people are worried, scared, and confused. As health professionals, we can help. Our job isn't just to give people information, but also to help them understand it. The classic tenets of risk communication are to be first, be right, and be credible. The first two are virtually impossible given the scale and spread of the current pandemic and the 24/7 news cycle. But we can be credible. And I would add that we can be clear and we can be empathetic. And this will go a long way toward improving public understanding. So let's talk about what this looks like. Being clear. Use plain language. Choose words that are familiar to your audience, avoid jargon whenever you can, and define it when you can't. Keep it simple. Think about what people need to know. Put the most important information first and keep your content direct and to the point. Provide action steps. No one likes to feel helpless, so give people specific actions they can take to help themselves and others stay healthy. And use familiar examples. When people are in a crisis state, which we are in right now, we tend to miss the nuances of health messages. We're on information overload, and so our brains simplify or shortcut messages. That's why it's even more important that we communicate clearly during a crisis. Many of us received a postcard in the mail with coronavirus guidelines for Americans. Now, I'll acknowledge it's easy to pick on some of these early communications. It's an easy target. This one in particular had no less than 16 different messages in this postcard. So the Communicate Health team took a stab at rewriting the guidance in plain language. First, we softened the language, and then we simplified the messages. You'll see we started with a main message at the top. Do your part to slow the spread of coronavirus. And then we included some actionable guidance. Stay home. Only leave your home when you really need to, like to get groceries or to work at an essential job. Stay away from people you don't live with. If you have to go out, stay at least 6 feet away from other people. Wash your hands a lot. Try not to touch your face. Keep your home clean. And if you're sick, stay home and call your doctor. We've also got a nice message here about remembering staying home doesn't just protect you, it protects everyone in your community. Most of you have probably seen this message on the left that came out of Texas. I think it's a great example of clear, familiar communication. One of the things that makes it so effective is how specific this example is. People may have trouble imagining maybe how long 20 seconds is, but this gives them a really good indication. The image on the right is out of Canada. We could obviously do some slight design improvements here to make this even more clear, but it's a nice use of the stoplight model reinforced with text to give people a clear picture of what behaviors are safe and which ones are not. And part of being clear is deciding when it's best to explain a tricky term and when it's best to avoid it. One of our participants today sent us a question about using the term vector. In this case, it's important that people understand the concept behind the term, but not necessarily the term, which I'd say is pretty jargony. So we might avoid it and instead say something like this. Some people may be infected with coronavirus and not know it, but they can still spread it to others. And then we might even want to go so far as to top it off with something actionable. That's why it's important to stay home, even if you don't feel sick. Next, we want to be credible. This means being transparent. Be accurate and honest and use credible sources, double check your information. Providing misinformation will jeopardize your audience's trust in you. Likewise, you want to be honest, including about the unknowns. In a crisis, we tend to hold on to our current beliefs. So we'll look for loopholes or weaknesses in conflicting or unclear messages so that we can interpret them as being consistent with our existing beliefs. And we'll often check multiple sources before taking action. This is normal behavior, it's human nature. And that's why as communicators, we have to be credible and transparent. If we're going to change the guidance on people, we have to acknowledge it. So for example, here's how we might want to communicate about changing guidance. Start by saying, we're learning more about the coronavirus each day. So there's a chance that health officials may recommend something different tomorrow, but based on what we know right now, it's safe to exercise outside as long as you stay 6 feet away from other people. And then we give a source, a reputable source where people can go for the latest guidance. And here's how maybe not to do it. Unfortunately, this is from the Surgeon General. So this is a tricky message here. There remains scant evidence wearing a mask, especially improperly, provides much benefit to a healthy wearer. However, emerging data suggests facial coverings may prevent asymptomatic disease transmission to others. There's a lot of jargon in this statement and a lot of confusing language. Another way to explain it would maybe to say, should I wear a mask? Yes. The CDC recommends that you wear a cloth mask when you go out in public. This is a change from guidance you may have heard before. It's based on new information that people can spread the virus even when they don't feel sick. It's still important to stay 6 feet away from other people and wash your hands with soap when you get home. Another way to explain it might be to say experts aren't sure if cloth masks protect healthy people from coronavirus, but they think cloth masks can stop sick people from spreading the disease. You probably all noticed also that CDC is doing a good job of this. They have a disclaimer on most of their coronavirus web pages talking about how it's a new disease and they're still learning about how it spreads and the severity of illness it causes. You'll even see in this example, they have a fourth bullet here talking about recent studies suggesting how COVID-19 might be spread. So they're trying to stay on top of their communication and their credibility by acknowledging what they know and don't know. And finally, we want to be empathetic. So we want to acknowledge people's feelings and the challenges they're facing. This is going to help you build rapport and strengthen trust. We also want to stay positive. People prefer a positive tone, we know this. And that doesn't mean minimizing what's going on in the world. Instead, it means emphasizing the benefits of taking action and withholding judgment. I've been lucky to be living through this pandemic in the state of Maine with some pretty great public health officials. One of them is Dr. Nirav Shah, head of Maine CDC. He's become our spokesperson for coronavirus response, and you'll see why in a second. I'm going to play a clip from him. But Dr. Shah regularly joins the local public radio station to share updates, and he takes questions from callers, sometimes for 1 or 2 hours at a time. So I'm going to play you a really short clip that illustrates what I think empathy sounds like. And hopefully you all will be able to hear this.
We are social creatures by our nature, and many of the recommendations that the Maine CDC, that Governor Mills, and the US CDC are making are hard. Let's acknowledge that. Asking people to stay away from one another, to avoid groups of 10 or more, that is not what we are about at our base. And I fully acknowledge how difficult that is. And I think, Jennifer, this is a great time to pause and recognize and commend and congratulate all the Maine people who have heeded these recommendations. I mentioned a little while ago that I spoke to a friend of mine last night who said that walking down the streets in Portland, they were vacant at 6 o'clock. That's hard, but it's also where we are right now in order to get a handle on this. And I just want to commend everybody for this act of good citizenship. It is not easy. It will certainly get better, but it will get better because we are taking these hard steps right now.
So most importantly, we want to be communicating, period. So this is a time for public health, not politics. And if you're struggling to get your message across, or if you're struggling to get people in your community to practice social distancing or stay home, remember, the pandemic isn't happening in a vacuum. COVID-19 is happening in an ecosystem of disease, information, misinformation, behavior, all of which helps us understand and ultimately stop the spread of the coronavirus. There are so many factors influencing people's behavior right now, including economic anxiety, fear, denial, grief. And consider how all the literacies we just talked about, fundamental literacy, science literacy, civic, media, and cultural literacies are all impacting individual decision-making. This is a time for empathy and compassion, not condescension. And if we join together and communicate clearly and authentically, we can empower people with newfound health knowledge, understanding, and agency. And we can build up their protective health literacy shields, and we will all be better off because of it. So I'm going to stop here and turn it back over to the IHA team.
Wonderful. Thank you so much, Stacy. What an incredible presentation and really a consolidated amount of material to think about. I hadn't really considered all the different types of literacy, to your point, the foundational knowledge necessary for folks to make sense of what's coming out now. We'll turn it over to Eskarlethe at this point, and she will walk us through some of the wonderful pieces that have been curated by the IHA team on the Health Literacy Solutions Center website. Eskarlethe?
Perfect. Hi, everyone. I know it can get overwhelming sorting through tons of COVID-19 resources. So to help, we created a COVID-19 resource page where you can access resources that explain things in plain language and that help break down this complex topic. The page is located on the Health Literacy Solutions Center, which is the website that's showing on your screen right now. I also posted the link on the chat box for your reference. Please keep in mind that we will be upgrading the site's platform in a month or so to be more user-friendly, but are using this one for now to give you access to resources in this fast-moving pandemic. So let's get started. From the home page, you will click on the Browse button here, and in the drop-down menu, you will click on Coronavirus COVID-19 Resources, which will bring you to the COVID-19 resource page, where you will be able to submit and search for COVID-19 resources that are easy to understand, are up to date, with credible and accurate information. Here's the way you can submit. Either by clicking here, clicking the submit button here, or this green box, submit your COVID-19 resources here. And I'll go ahead and click this one for you. Okay. It will take you to this resource submission form, and the top half will be information about yourself, and the bottom half will be information about the resource. Now, if the resource was a resource that you didn't create and it was from another author, just go ahead and make sure you put that here, fill in the rest of the information, and keep in mind to tag the resources as COVID-19 in this keyword section, so others can find it when they're searching for COVID-19 resources. Another thing I wanted to highlight is under languages. If the resource that you're sharing is in multiple languages, in this section here, type in multilingual so that others can find it too. Fill this whole section completely and submit it. Now let's go back to the COVID-19 page by going to Browse, Resources, and I will now show you how to search for resources. You could click here, or you could click this green box, COVID-19 Resource Library. For this time, I will click this one up here. Search COVID-19 resources. And it will take you to this page where you can see two folders. One is resources for professionals, and the other one is resources for the general public. Keep in mind that you would need to click on this arrow so it could drop down subfolders of different ages or a COVID-19 overview. And click on communicating to children, and voila, there you go. We have resources in regards to COVID-19 for children. If you want to find a resource that is in multiple languages, like I stated earlier, you can find it by clicking here. Let's go to resources. Search resources. And in this search bar, type in multilingual. Scroll down. And it's important that in the user tag, you click multilingual and then select the user tag of COVID-19. Scroll down. And then here you can access resources that are in multiple languages and relate to COVID-19. Now go back to the COVID-19 page again. Resources. And I want to show you that if you scroll down, that we also highlight some resources on a weekly basis. And you can see them here. Right now we have a video, a website, and a handout. And by clicking here, it will take you directly to that resource. I also wanted to show you other ways that you can access this resource page from the home page. And right here, we are stronger together. If you click on it, it's like a shortcut, and it will direct you to the page again. Okay, let's go back to again. I wanted to show you that in the middle of the home page, there's a box section, and it also displays the recent uploads of COVID-19. As you can see, 5 hours ago, website in regards to COVID-19 health literacy project was uploaded. And if you keep scrolling down, there's a green box section here that is also a shortcut to COVID-19 resources. Click on it, and here we are again. Resources for professionals and resources for general public, and then scroll down. COVID-19. And now that you know how to navigate the COVID-19 resource page, take some time this week to share your resources or any resources that you've come across. And if you haven't done so already, don't forget to create your free profile by clicking here for the Center for Health Literacy Solutions to connect with the health literacy community, participate in discussion, and get informed on upcoming events and webinars. Thanks for everything you do, and stay safe and healthy. Now I turn it back to you, Jennifer.
Thank you very much, Eskarlethe, for that orientation. I was on there actually on behalf of a client earlier this week looking for some materials, and it was very convenient to have it all in one place. As we've been mentioning in the chat box, please feel free to pose your questions for the speakers. I will moderate the discussion. We have ample time left for Q&A. Again, if you hover your mouse near the bottom center part of your screen, you'll see a conversation bubble. If you click on that bubble, you will open up the chat function. It is found at the bottom right corner of your webinar screen. You can send your question to everyone. You have a drop-down menu. It says send to. You can choose someone specific from the list or to everyone. In order for us to be able to pose it, let's go ahead and send it to everyone, and then I will field them to our speakers. I've seen a number of people asking, will this excellent presentation be available? The answer is yes. The Health Literacy Solutions Center posts all webinar recordings to the website. So it will be available. You'll receive an email when the recording has been posted. So in order to get started, I know, Stacy, we have a number of questions for you, and I just wanted to see, come up here and share. First of all, we're getting a lot of wonderful appreciation and feedback for your presentation. Stacy, Brad is asking, with so much mistrust between consumers and mainstream media, how do you recommend that mainstream media works to build back that trust at a time when communicating life-saving health information is so essential? Any thoughts on that?
Yeah, that's a great question, and I think that's something that a lot of us have been feeling. I know many of us in public health have been talking about missing some of that credibility and that guidance from public health professionals. We're hearing a lot more, I think, from politicians than we are sometimes from public health professionals. And so I think building up that credibility, the first step is thinking about the credible sources. So I know Dr. Fauci has kind of emerged as a hero in all of this. And part of that is the credibility, and we need more credible sources like that. I shared the example of Dr. Shaw up here in Maine. Sometimes it's not a national figure, sometimes it's a local figure who has the trust of the community. And I think the more that we can be featuring and highlighting those voices, it'll go a long way towards building that credibility back up. I think the other piece too that I talked about a little bit is just acknowledging both the uncertainty and the changing information. And I think the media is quick to say, that we got it wrong the first time around. And I think if we can be sharing some of those messages that it wasn't necessarily that we got it wrong, it's that we've learned new information, and so we're shifting, and here's why, and here's what you need to do about it. So going back to some of those messages, especially coming from credible sources, I think will go a long way.
Mm-hmm. And especially one of the challenges you mentioned, you're in Maine, I'm in California, and there, we have a number of states in between, and they all seem to be handling the crisis in slightly different ways. And so there's not only the national message coming out, but also the local message and what's happening in your community. You have to sort through multiple layers. One question that came in from an attendee is, what have you seen out there? What example of private corporation effective communication would you highlight? Is there anything, or even public, that stands out to you?
Yeah, that's also a great question. This is something that I pay a lot of attention to, in addition to being, a health literacy geek and public health person. I'm also president of a company with over 90 employees. So I spend a lot of time also thinking about how to communicate at a corporate level. And I think that type of communication, both internally to companies that can share with their employees, and also, what they're putting out to the public, is really important right now. And I would actually urge folks who are in a position, maybe you are leading staff or managing staff, that all these same tenets really apply. So, communicating early, communicating often, communicating clearly, and being really transparent. So as a small business owner, I'm saying things like, I don't know for how long we can be doing these actions, but for right now, here's what we're doing, here's what we're committed to, here's what this means for you, those types of messages. So one of my favorite things coming out of the private sector is in addition to the communication, is just the innovation. We've been seeing a lot of companies step up, making masks, making ventilators, making protective equipment, all sorts of things, really being able to pivot in this time of need and be there for communities, I think is really nice. So I'm actually heartened by, I think, the response of not just our local service sector and nonprofit sector, but actually the corporate sector stepping up with that idea of shared responsibility.
Mm-hmm. And I know that certain organizations have been at the forefront of this public health response, as we would expect. The World Health Organization, known as the WHO, and the Centers for Disease Control and Prevention, known as CDC. Someone mentioned that it's important to not just say CDC, but to explain what it is. We take that for granted if we're in this field, but the importance of sort of stating what may be obvious to us, we can't assume that of our readers or audience. The next question I'd like to have Eskarlethe answer, and we're getting some interest in the idea of being able to post materials to the COVID resource section. Individuals are asking whether or not you need to have permission to post it, or if anything can be posted, and also whether or not IHA is vetting what gets posted. So Eskarlethe, would you like to take that?
Yes, I can answer that. In regards to posting third-party material, yes, we'd love to have any COVID material that follows health literacy best practices in the Center for Health Literacy Solution website. It's okay that if you come across another material that isn't yours, let's say the CDC comes up with like informational sheet in regards to COVID-19, and you think it's a good resource to share here, go ahead and submit it. We would love to have those type of resources.
And
we do look at the resources that are being submitted, and if we do notice something that's, I guess the way I could put it is that we're not so strict on what's getting uploaded, but if we do come across a resource that is off the topic and doesn't follow health literacy best practices, then yeah, but right now we don't have a strict process in that.
Thank you. Stacy or Eskarlethe, I think both of you could speak to this. Are there any resources, Danny is asking, that define most COVID terms for those with low health literacy?
Well, that's a great question. I haven't seen a comprehensive source, but I think there are some folks who are working on this. I know at Communicate Health, our We Heart Health Literacy team is working hard at defining a lot of the terminology, both in our weekly We Heart Health Literacy posts and also on Twitter. In between our Thursday posts, we're trying to tackle some of the terminology. I'll say also, what I've seen in the New York Times has been really helpful, sometimes in fact more plain language versions and definitions than what I've seen in other places. So that's an interesting place to start. A lot of their guidance has been really clear. They've posted videos and things like that to define some of the terms. So I'm not sure if Jennifer or Eskarlethe, if you have other thoughts on that.
Well, Julie McKinney has weighed in, echoing your sentiment. I think she says, I think the New York Times has done a great job with the visuals they're using to report numbers and stats. And Casey Adams Jones is mentioning that one tool is to tag the CDC in your posts on social media to help explain who they are, and that also saves space so you can focus more on messaging. Sometimes, depending on the platform you're on, you put the @ sign in front of the CDC or a hashtag in front, but that also can often allow the reader to link directly to that site. There's a glossary. Just keep an eye on the chat box right now. Holly just posted a link to a glossary. It looks like it's the Kaiser Family Foundation glossary on outbreak terms. So once again, our community is really the best source of these resources, because we have so many eyes out on what's being published. Stacy, I wanted to come back several people have asked about messaging for specific groups, and 4 examples have come up. Just messaging to essential workers, messaging to people who don't have a primary care provider, messaging to the African American community, or to individuals who may be hearing impaired. Obviously, those messages require a little bit of nuance. Would you like to speak to that?
Sure. Yeah, those are all well, those are all very different different audiences. So I'd say maybe the place to start with that also is just to say, as communicators, you know, our first job is always to identify our audience and figure out what their specific information needs are. And right now, those needs are going to be different. So all of those groups you just mentioned are going to have really unique information needs. I will say for hearing impaired, I've actually seen, I believe on CDC's website, and other people know of others, but were posting 1 or 2 videos with ASL explaining some COVID terms. So I know that exists. In terms of, you know, essential workers and some of those groups, I think one of the biggest pieces there is that empathy is really acknowledging the fear and uncertainty. And there's a lot of that right now about either continuing to work or going back to work. So I think, you know, we go a long way by sort of acknowledging that that there is risk and there is fear, and giving people those very concrete steps that they can do to protect themselves. Again, everyone wants to know that they can, you know, they're not helpless in this situation, and they can take those steps. And for the African American community, I think that's a great question. I think this is going to be this is something that we're talking about right now and going to be talking about a lot. And again, here, this is that transparency and trust piece, and that starts with acknowledging the differences and the different experience that communities of color are having right now, and acknowledging that we need more data, we need more information. This is what we're seeing right now, and also acknowledging that their experiences are different. I know I shared the example of what it might be like to wear, you know, a mask out in public. Those are real risks that folks are balancing, both their safety and risks of racial profiling, you know, compared with the risk of getting COVID. So I think those are really real, and we need to be acknowledging those in our communications and doing that empathy piece. Also, obviously, credibility is going to be huge with these groups. So thinking about who are your spokespeople, who has credibility in the community that can be, you know, if you're not a member of that community, that you can be partnering with as you're sharing messaging.
Right. Well, your wonderful points about connecting the dots, not just telling people what to do, but explaining how their actions will result in some sort of benefit, either immediately to them or to society, or both. Incredibly important, and harkens back to the basics of adult learning theory. Adults don't like to be bossed around. They want to be able to make their own choices, but our job is to give them the information so that they have that motivation to do so. Thank you for those wonderful examples. And I just want to highlight again that you spoke about sort of the mediating role of trust in all these communications, and the importance of credibility. And I think those are two really important themes we don't often discuss, but are absolutely essential. So thank you very much for highlighting those. I want to invite Diana Gonzalez from the Institute for Healthcare Advancement to speak a little bit about the question of what materials or how materials will be vetted on the COVID site. Diana?
Yes, can you hear me?
We can.
Oh, wonderful. Yes, so thank you, Stacy and Eskarlethe, for such a wonderful presentation today. I did see the questions coming in about vetting and about the CDC and maybe not using, you know, synonyms, but or acronyms. But I wanted to, for the vetting process, what happens is once the resources are submitted, like Scarlett said, we don't, check the people that are submitting on once they submit the form. Once we get that form on the back end, we do vet the resources and look them over. And then once they, clear the information background, we put them up. Also, I'd like to add that each resource, there's a comment section at the bottom of the resource. And so this is really a resource for the whole website is a resource for the health literacy community. And so it's, checks and balances. So if there's something up there that is something that, you see some misinformation, or maybe the link doesn't even work anymore, definitely write into the comment box or reach out to us and let us know, and we'd be happy to correct that. And I'll also go back and change the CDC. I think that was a great recommendation. Thank you.
Wonderful. Thank you, Diana. I would like to, since we're all in this community together, and we have just a limited amount of time together, I want to stress a couple of things. First, this presentation, recording of this webinar will be posted on the Health Literacy Solution Center website. So you'll be able to hear all of the questions posed to our presenters as well as their answers. So we'll send out an email to everyone once that recording is posted. Julie McKinney has also asked that everyone on the webinar here also weigh in on the listserv question from yesterday about messaging to address disparities. So there's additional dialogue continuing on the listserv that so we can continue to build on the wonderful resources that have been talked about here, and the advice that Stacy has put forth. So with that, I would like to just take a moment to thank Stacy, Eskarlethe, Diana for all of the content today and for today's presentation. Stacy, it's always a pleasure to hear how Communicate Health is approaching these issues. It's really in real time, and it's also encouraging to hear that it isn't always easy for you either. As a seasoned health literacy professional, I know people are struggling still with having to convince providers that the value of plain language. These are persistent challenges in our field. So I thank you for just being real and forthright today on your
Thank you so much for having me, and thanks for this opportunity, and thanks everyone also for the really rich questions and dialogue. I appreciate that.
Well, we're very grateful to have this opportunity to bring forth the experts in our field. I can tell by the robust discussion on the chat that this was greatly appreciated. Again, the recording of today's webinar will be posted in the Health Literacy Solution Center webinar archives. Look for an email containing a link to the evaluation form so you can get CEUs for today if you signed up for those. Again, you must complete the evaluation form in order to receive those CEU credits. I mentioned this is the first of 2 webinars that will be held in April. Our next webinar, Building Health Literate Care Through Meaningful Patient Engagement, is scheduled for April 30th. You can register on the Health Literacy Solution Center homepage. Thank you, everyone, for your time today. I hope everyone stays healthy. Again, let's continue discussions on the listserv, and we look forward to hearing you and seeing you and your questions on the next webinar on April 30th. Thank you all.